Mode.
Good afternoon, everybody. This is Eric with American Business Systems. It's good to have you here this afternoon. It is the day after Christmas. It is December the 26th of 2013, and we're going to be talking with you today is the medical billing opportunity too good to be true. Now, this is a great webinar that Patrick has put together over the last couple of days, and it's certainly going to be one that, as we're going to get this recorded, might be one that you want to listen to a little bit later. Again, we just want to welcome you this afternoon. I know that you're taking out of your time. Probably you're taking some time from your family. And so we're so thankful for to have you here on today. Let me see if I can get to the next screen here. There we go. Here's a picture of myself. I just wanted to, again, introduce myself. I'm Eric Oj with American Business Systems, and I'm the Director of Research and Development, which that means is every part of what we do here at American Business Systems is being tested and tried just to make sure it's not just theory like so many other organizations can be out there. We really truly test the things, whether it's in the marketing side of it or on the medical billing side of it. We are out here physically testing it out, making sure. Well, we want to ensure that I'm being heard today, so if you don't mind, you'll see that little icon of a hand about right there in your GoToWebinar control panel. And if you don't mind clicking that hand, that'll allow me to see that you can hear me loud and clear. And William's already indicated that he can hear me. So thank you, William, for taking your time out today. Ron, good to have you here this afternoon. Rashta, good to have you. Gangadhar, good to have you. Rose, Wayne, good to have you guys here this afternoon. We still have some more coming on in, so we'll just let those folks come on in and join us here. If during the presentation at any time you want to ask us a question, just type that question in right where it says type question here, and we'll be able to take your questions as we go through the afternoon. Well, let me explain to you who American Business Systems is and what we are and what we've been able to do is to help folks like yourself, help physicians stop running two businesses. We wanted to kind of put this way up here early on because we get this question asked a lot. Why would a doctor use an ABS licensee? Well, first of all, their first and foremost thing that they do is to take care of patients. The medical billing side has become so specialized that they really do need someone to outsource. Where they were doing it in-house, in essence, they are running two businesses at a time. So what we've been able to do with so many folks just like yourself on the call and that you see here on the screen, folks just like yourself working from home, if they so choose to, can help these doctors take that burden of running that second business away out of their office so they can focus on doing what they do best, and that is seeing patients. What's helping them with that is our system that you can see here briefly. Patrick and I are going to explain that to you here in depth today. This is helping not only the doctors, but you as an ABS licensee to actually do that type of billing for those doctors. That's how we're doing it. If you haven't been out to our website yet, we want you to encourage you to go to absystems.com. There you'll get into about the business package and the income potential, but really where you can do your deep due diligence is in these two orange boxes here. Just tap on those. That'll get you into what's called our virtual brochure. And this is where the in-depth study really comes into play. A lot of people don't have time to maybe take a call from us or even be on a live webinar, but you certainly could take the time of going through our virtual brochure, and this is the way to do it. ABS has also maintained our A+ rating here at the Fort Worth Better Business Bureau, so you could check us out there. If you'd like to, like so many people, even as of last week, came by and visited us here at our office at 5751 Kroger Drive here in Keller, Texas, which is just north of Fort Worth. We'd be happy to pick you up at the airport and bring you on over to our office there. Our next training workshop is next year, but it's only a couple of weeks away, January the 20th through the 24th. And we're looking so forward to having this new year get started off on the right foot, so much that we're celebrating our 20 years here at American Business Systems. And for those that are attending the January training, here is your incentive. Patrick is actually giving away an iPad mini to every licensee that shows up for the January training. Now, this is not something we're just giving out a chance to win. This is actually every licensee who attends our January training is actually going to get an iPad mini. So if you haven't thought about it, you might want to join us here for to help us celebrate 20 years this January. Let me introduce you to our CEO, Patrick Phillips. He has written 2 books here, as you can see here. He's actually written more, but I want to highlight these 2. How to Reprogram Yourself for Success, and then The Cash Crunch to Cash Flow. This is, folks, this is your Bible in really knowing what's going on with the medical business and how we can actually help those doctors get going through everything that they're going through and how to plug those hidden leaks that is really, truly draining their profits. So let me see if I can get to the next screen here. I think we've got Patrick is possibly on with us here, and we'll get started here and go through your questions. Oh, let me share with this is that he's also someone even asked me today, are we well known in the medical business field and in the arena of medical billing? And we are. Folks, we're not advertising in these magazines. We're being asked, matter of fact, Patrick Phillips is being asked to write articles in such magazines as the Billing and Coding Advantage magazine. So these are not paid subscriptions as some people do, or paid advertisement in a format as a article. These are they're calling us to ask us about about being in business and medical billing, and Patrick has been able to write some of those articles. So again, let's get Patrick on the webinar with us. Patrick, it's good to have you. If you're like a little bit me, you got a little stuffy nose today, but I think we're going to make it through today.
I started to say, you sound like you're kind of stuffed up. Down here in Texas, the weather is so weird that sometimes, it's the only state that I know of that you can get frostbite in the first part of the week and then sunburn in the last part of the week. So
exactly.
That's what happens, and it causes havoc with our allergies and things. Well, let's jump in here, Eric, because the question is asked a lot. I get this question a lot. Is this medical billing opportunity too good to be true? Because it seems like, to some people, as they investigate this further, that it is too good to be true. Is it? You know, you've heard that all your life. If it's too good to be true,
especially here lately.
Yeah, and if it sounds too good to be true, then people say, well, it probably is too good to be true. So that means it's not true, right? Well, all of this is true unless it is true. I mean, if something that you're sharing with people really is what it seems to be, then that means that not only is it true, but it is something that's really good. And that's why we want you folks to ask all the questions you want during the webinar today using the little question box there on the side, like Eric said, so we can jump right in there. Eric, I'm going to turn my monitor off here because I think there's a little delay in what we're doing here, so we can jump right into it. All right, so what is it that seems to be too good to be true? I started out with this question because I've asked people that. Well, what is it that to you seems too good to be true, if that's what you think is going on here? So let's start with the first thing that we hear. First of all, I've heard, I think it's too good to be true that all you need to know is taught in those 5 days in your live training workshop down there in Texas. And Eric just mentioned that the one that's coming up here, of course, is in about, what is that, Eric, about 3 weeks from this Monday?
Yeah, about 3 weeks from this Monday, and that is true, Patrick. We get asked quite a bit. You know, people have this thought that, gosh, if I get into this medical billing, gosh, I'm going to need to know all these codes, and I'm probably going to have to go to school. And this is where I think people say this has got to be too good to be true, because how can you teach me all of what I need to know in 5 days?
Well, one way we do that is by keeping the class small. As you can see from this picture here, what is there, 2, 4, 6, 12, 14, there's about 16 people total in the class. So we keep these classes specifically small so that we can give the attention necessary to each person in that class to answer all the questions that they might have during those full 5 days. And those 5 days go by much faster than you think they are. This is not a boring lecture type thing. It's very interactive, as you can see from a lot of the things stuck on the walls around the room there in this picture here. We keep it very active, and it's set up in a classroom situation like a conference so that you're actually hearing and seeing everything that everybody else in the class participates in. We have several instructors that come in. The lady that you saw just in the previous picture there was one of our licensees from the Phoenix area, Cynthia Anderson. And of course, this is Eric. He's one of our instructors as well. We teach everything there is to know about this in 5 days because we're going to give you time to put your hands on the system and see the iClaim billing system yourself live right there during the class. We also have interactive learning, which means you're actually interacting with other people in the class to learn by teaching one another. Eric, I think this is the most unique part of our whole class. I don't think there's many workshops that can truly be called workshops because they're mainly lecture, but not.
Right, and I think that's, again, I think you've hit the nail on the head here, is that it truly helps you as a licensee. Patrick, let's just get down to it. What you're going to learn here is how to go out and get clients. That's where you need the help, and that's where even we've had people, Patrick, from medical billing companies that have come and joined us just to get the help of getting clients.
Yeah, they've been in medical billing for years and yet did not know how to bill their medical billing practice the way they should. So they come down to our training. We also bring in an attorney, Judy Brown, who has been practicing for about 20 years now here in the Texas area. She helps licensees with their questions concerning the way they set up their business. So, folks, it's not only about the medical billing business specifically, but in general, we're going to help you know everything that you need to know if you've never owned your own business as well. Again, various guest instructors are brought in. We're going to teach you everything you need to know to get started. Now, Eric, let's be honest about this. When we say you're going to learn everything there is to know, that's to get started in this business. They're not going to learn everything they need to know about medical billing or coding, right?
Right. I mean, I think you and I were talking about this earlier. You and I are still learning so much every single day. And folks, that's why it's so important to be part of American Business Systems, and that is because you gain the knowledge of the 20 years that we've had that's what we've been able to gain and give to you.
Right. And we teach every aspect of what's called the revenue cycle for doctors, because it's not just about doing the billing or even collecting money from, the patients, which are two ways, of course, that doctors collect their money. It's all about every aspect of the practice that has to do with revenue. All we're about and all you're going to be about as an ABS licensee is getting the money for doctors, more of it faster.
Yeah.
So our training manual, the whole training week, covers everything there is to know about this business, everything that you see here listed on the index page of the student manual. And I think I have a slide here. Yeah, here's some of the topics that are covered during that week. Guys, it's very in-depth. Believe me, we have, a total of about 35 hours total, I guess, Eric, Monday morning, 8 o'clock till about 1 o'clock on Friday. So
that is correct.
And we even go sometimes past time in the evening if we need to answer questions, to give people more hands-on, one-on-one time with us and the instructors. Whatever they need during that week, we're there to get them through that week. We cover, again, everything about our billing system called iClaim, which is our web-based system, and the electronic medical record system. We go into depth in that. We actually put the computers in the room. You don't have to bring a laptop. We provide the laptops and actually let you and your partner go through and put in claims as if you were doing the billing yourself right from your own home. It's live. It's over the internet, just like you'll be using it over the internet. And I think this is the most exciting part for most people, don't you, Eric?
Absolutely. And folks, we do get you to do that, again, like Patrick said, on day one, because we know that that's probably the most fearful thing for most folks is, how am I going to get through and navigate through the system? And we try to bring that fear level down because, again, we really want you to get out there and go get your own clients.
Yeah, it's not brain surgery. What we go through is not something that's really, really, in-depth. This is the most user-friendly system that you can ever imagine, folks. And, of course, it runs on the iPad. That's one of the reasons I'm giving away in January, for January attendee licensees, they get the iPad mini, because we're going to show you how to actually run our system and show this to a doctor anytime, anywhere, 24/7, where there's an internet connection. Okay, well, that was one of the things we hear, Eric.
That's right. Let's talk about no billing and coding background or training. And again, this kind of goes hand in hand with those 5 days. And Patrick, when you and Linda started this, I don't think either one of you had a college degree in medical billing.
No, in fact, Linda had no training whatsoever. Neither did I in the medical field at all. And yet, a friend of hers asked her if she could do the billing for his company. He did durable medical equipment, and so he would bill Medicare for that, you know. And so she said, "Well, I don't know how to do it," but in about 3 days, she learned how to do that in this guy's office. So, folks, we did it. We teach other people to do it. We've taught hundreds of people from coast to coast to do it. And one of the reasons that you don't have to have any billing or coding background is because some of the services that you are going to be able to offer to the doctors are actually performed by our certified medical coders that we have available to you as an ABS licensee. So you don't have to know the coding. These folks know the coding enough to provide services like our Audit Guard, our CodeWrite service. These are things that you'll learn more about as you read on our website and ask your ABS rep a little bit more about these. But folks, that's why you don't need to know it, because we've got people who do. We also have folks on our advisory board as well. Eric signed up Dr. Sally Combest. She is a doctor down in the San Antonio area that decided she wanted to get out of the clinical side of medicine and into the business side, what she calls the money side. And so she is on our advisory board. We have Terrence Patterson, who also has a medical health administration degree. He's one of our marketing consultants for our licensees. You'll see all these people listed on our website under, I think it's called About Our Team. And then there's Jeanette Weiler. She is a certified professional coder. And then we have, in addition to her, of course, dozens of other certified coders that are available to our licensees to help with the coding side. So again, like Eric said, you don't have to know all that. We've done all that for you.
And Patrick, as we're going through these too good to be trues, one of the other ones is, how do we bill for less than what the doctor can do? I mean, this not only bill for less, but then, you know, the whole thing. And I think that, you know, this article that you found, gosh, I think this was at the end of last year actually, in US News magazine, about this doctor. I cannot pronounce his name.
Don't even try.
Yeah, don't even going to try. But I mean, this is what he says. To get paid by the insurance companies, I have to pay about $20 in administrative fees just to collect it. Between the person that bills, the computer system, the ongoing support, it costs me $20 per claim. Now, if we take it into our world, you know, as doing the medical billing side of everything, we're talking. We can take it from $20 per claim down to about $6 to $7 per claim.
Yeah, because we teach people to charge the doctors based on the revenue that they collect for the doctor, a percentage of that revenue, and that revenue runs that percentage anywhere from 5 to 8, sometimes up to 9 and 10%, right, Eric?
Right.
And so if you compare that to $20 per claim, well, here's another quote that kind of verifies what this doctor says. This is from the New England Journal of Medicine. Market analysts estimate that 24 cents out of every dollar are wasted on the administrative and billing expenses. Now, that seems to be 24% of their costs, and you compare that to your maybe 6, 7, 8% that you charge the doctor. It's a bargain. You definitely will save the doctor money over that. And then here's this quote about how much it costs a doctor when you include all the phone inquiries, the additional cost of duplications, extra administrative expenses, and resubmissions, that it can cost as much as $57 per claim.
Yeah.
Some doctors don't even get paid $57 on some visits.
You know, and to explain that, that's after the doctor has supposedly gotten from the patient their copay, maybe any deductibles that need to go on that particular claim, and then what is actually reimbursed on that doctor could be just as much as what it costs them to actually process the claim. So it's like a zero claim reimbursement here. So those are the things, folks, that we will teach you and show you how all of this works behind the scenes. And this is how we're going to help you go out there and talk intelligently and go out there and get those doctors.
Yeah, so if it seems too good to be true that you can actually save the doctor money, let me just run through real quickly a little chart here that we came up with on the annual cost for physician billing. Now, you'll notice that on the far right-hand side, it's showing a figure of $28,000. The way we got that is we estimated that you were charging this particular doctor who was doing 400 claims a month in a year's time at $100 per claim, 6%. So that's where we got the 28,800. Now that would be the money you would charge the doctor in 1 year's time to do his billing, which for a lot of people, of course, is a pretty nice income figure just in and of itself. But look at what a doctor would normally spend himself or herself in their office if they had, say, 1.5 full-time billing employees at $15 an hour, payroll taxes for those people, workers' comp insurance, errors and omissions insurance to cover their errors, training costs for those people, leave coverage when they take vacation time, for example, all the benefits that are wrapped up in hiring employees. When the doctor adds all that together and then throws in the hardware and software upgrades and IT support for his computers, he could spend upwards of $65,000. Now, folks, compare that to the $28,000 you'll charge the doctor, and you can see how you're actually charging him 48% less than what it takes to do that inside of his own office. I know that seems too good to be true, and you're probably asking yourself, well, then why don't all doctors outsource all of their billing to, licensees? It's because we haven't got to them all yet.
Exactly.
In fact, the Medical Group Management Association, which we're members of, Eric, as you know, we just joined this year, did a survey just this year. It said medical practices that switched from in-house billing, that means doing it themselves, using their own staff, to a medical billing company, saw a reduction in their accounts receivable of 73%.
Yeah, let's stop there real quickly. I'm going to stop you there. Why is that? Well, let me tell you why it is. Because those that are doing medical billing from a business opportunity, well, from just a separate third-party billing company, they're not going to get paid until the doctor gets paid. So, Patrick, kind of explain how the people that are in the doctor's office, whether the doctor gets paid, they're going to get paid, correct?
Yeah, right. The pay is the same. In other words, if a person who's doing the billing for the doctor does not get paid on a particular claim, that claim kind of gets set aside. They used to have a term for that, Eric. They used to call that the Porsche drawer, because
Right.
when they were filing on paper, a lot of doctors file electronically now, but on paper, that went into a drawer and they never got to it. And the doctor says he could have bought, that fancy car, the Porsche, if he could have collected all the money in that drawer. Well, that's because their pay is the same no matter what. And so we can reduce that accounts receivable, that's the money that's owed to doctors, by up to 73%. They also found that practices that switched from doing it themselves to a billing company realized higher collections of 73%. In other words, they collected that much more money from their patients, the insurance companies, Medicare and Medicaid. 53% of them decreased the volume of lost or denied claims. And 59% enjoyed significantly better reporting and practice performance insights. 46% of them achieved higher staff productivity. Eric, isn't that really why the people in a doctor's office don't need to be scared of a billing company coming in? They're not necessarily going to lose their job, are they?
No, no. And matter of fact, again, for doctors' offices, it truly does, you know, equivalate out to a better productivity in the office because, again, as I mentioned very early on in this particular webinar, that doctors are trying to run two businesses. One is a medical billing company, and one is just the medical billing, the medical practice in and of itself. So you can see why, the staff will feel less stress whenever they're not so worried about getting the doctor paid. Did we get this doctor paid? We have to chase down that insurance company. We have to file for that insurance claim. It truly does take the productivity to a new level within this doctor's staff office.
Well, which basically means they can help the doctor see more patients. That's where the doctor makes the money, is in seeing patients. All right, so let's move on here. Okay, the next too good to be true that I get from people is that there is no sales experience needed.
Right.
Eric, we find that to be true. What would you say the percentage of people that come through our live workshop, what percentage actually have any sales experience even?
I think probably maybe as low as 10% of all the licensees that we've had over the years that have actually any sales experience. And those folks, we tell them to forget about everything that they've learned because that's not the way you sell to doctors.
That's right. If you go in and try to do any kind of sales to the doctor, you'll find that that's the wrong way to approach them. As we'll show you a little bit later, we call it the consultancy approach. That's what we teach. And one of the reasons you don't need any sales experience is because of all the different ways during this week that we're going to teach you to go out and do the marketing. We have an automated direct mail program, for example, with postcards and greeting cards that can go out to do the marketing for you so that they call you and ask you to come in. We have hundreds of email templates for those of you who want to use email marketing, and we'll teach you the best way, the tips and rights and wrong ways to do email. We also teach you how to do trade shows and conventions. Eric, you've done some of these yourself, haven't you?
Exactly. Yeah, and they're great ways to get those doctors to actually start coming to your booth and talking with them. And that's what you really want. You want to have a conversation. And I tell you, once you have a conversation that the doctors feel a little bit more relaxed, I'm telling you, you're going to start to see those doctors open up a little bit better. And then all you need is, hey, when can I come by and visit with you? And they'll say, oh, yes, please see my office manager, and she'll get you in.
Yeah, and the booth that you see here, for example, is actually provided to our licensees. So you can actually borrow that booth that you see set up there for this couple to use at these trade shows and conventions. So you don't have to spend the $4,000 we did for that display for those things as well. We also teach you to do educational events. Now, these are events where you can have little seminars or what we call lunch and learns. We'll show you how to have those hosted by various entities within your city. Sometimes they pay for not just the room, but they pay for food to get people into the room as well. So these are office managers and doctors that will teach you how to pack that room full of those people to teach them everything you need to teach them about their cash flow. One of the things you can give to them as they come to those webinars and seminars and things is my book, Cash Crunch to Cash Flow, how to get more money faster into your professional practice or small business and plug the hidden leaks that are draining profits. This is a great book to give away as a drawing, for example, at those. And so we're going to teach you how to get to the doctor themselves using handouts like you see here, this article that I just wrote for the BC Advantage magazine, how doctors can cut their billing costs by up to 50%. These are marketing pieces that you can use in the marketing of your services or, as you'll see here shortly, give to your sales reps as well.
Hey, Patrick, real quickly, I tell you what, let's do this. Let's go back to that one slide that you had there. I tell you what, let's do this. Anybody that's on the webinar today and you'd like to get a copy of this, just shoot us an email and we'll be happy to respond to you, and we'll get you a copy of this in a PDF format so you can see what we're truly saying. How about that, Patrick?
Good idea. Just get back with your rep, whoever sent you the email to this webinar probably, and respond to that email. And just ask them for a copy of the article, Patrick's article. They'll know what you're talking about there.
Yeah, because it's dated there January 2014, right there at the bottom.
Yeah, this was just published. That's right. It just came out in the magazine.
Yep.
Educational marketing. We have educational marketing pieces on all of our services that you'll be able to utilize to do your marketing. So again, we don't call it sales because all you're going to do is educate the office manager and or the doctor enough to the point where they say, hey, call them and have them come in. Let's talk to them. Maybe they've got something there that can solve some of our cash flow problems. And Eric, the doctors are struggling right now from a cash flow standpoint, aren't they?
Yes. Matter of fact, you know this as well as I do. Just a couple of weeks ago, I sat down with a doctor here locally who is a surgeon. Now, a lot of people ask, hey, can we do billing for surgeons? We absolutely can. And I tell you, Patrick, as soon as I introduced myself and I sat down to talk with him, his response to me was this: Eric, if you guys can't help me, I am going to quit medicine because it's too much of a struggle.
I remember you telling me that. That is, I wish we had videotaped that. That's a great testimonial, isn't it? Because people don't realize that doctors, even though you think they make a lot of money, some of them are just getting by. I mean, they're struggling to just stay in practice, as this surgeon was. Speaking of doctors, we also have marketing tools like this one. This is a DVD that actually has video testimonials of 5 doctors who can tell you exactly why they decided to outsource their billing. And folks, we also have doctor references. When we engage through you with one of your doctors, Your doctors may want to talk to a particular doctor in their field, their specialty. We can give you the names and phone numbers of doctors after we've done a demo for them of our system to let them talk to doctors and prove to themselves that this is something that's really worth getting involved in. We teach all about promotional marketing during the week. We'll be showing you how to find all these little items and the best things to use in your trade shows and drop-offs when you're calling on doctors' offices. We'll show you how to connect in your community through what's called business networking and your warm market. And of course, we'll show you our web-based automated marketing that involves the printed postcards and greeting cards that will automatically go out each month to your prospective clients to keep your business at the top of their mind. Professional websites. You get a professional website that could cost what, Eric? I don't know what you pay for a website nowadays. $2,500 maybe?
Yeah, at a minimum, $2,500.
And we've got them all worked out with beautiful designs that you can select from and just pick the one you like.
And then what Patrick had mentioned earlier about the consultative approach. This is how we do this. And matter of fact, I was talking with someone earlier today. Are we going to teach you how to actually go out there and get clients today on the webinar? Well, in a sense, we are, because we're teaching you and showing you that we do that through a practice analysis questionnaire. And this is just a sample of one of them that we have, and we've updated it and upgraded it from there, because what we really want to do is capture what's going on in that doctor's office. It's like you going to the doctor. The doctor doesn't start to do anything to you until they do they say, tell me what's wrong with you today. And that's what this whole consultative approach is about. So again, going in there and trying to sell doctors on a piece of software, that's not what we're teaching you to do. What we're teaching you to do and showing you, and again, because of our research and development side of everything, a proven fact, not theory, about how to actually approach these doctors very specifically using the practice analysis questionnaire.
I didn't mean to just throw you under the bus while ago and leave you hanging on this slide. I got into a coughing fit and had to mute my mic there. So
I kind of figured that. So no problem. But this is we are certainly a team, and you can tell this is live as much as you can say.
All right. We also show you and have for you prepared proposals, professional proposals. How do you present your services to the doctor? Folks, these are templated. That means you can replace everything in them with your contact information and your figures. And it makes it real simple to prepare the proposal and to present that to the doctor in a nice professional laid out presentation folder. Our support people will also review that proposal with you to make sure you're not leaving money on the table and getting the business. And then I mentioned earlier about sales reps. We have a whole sales rep presentation during our training on how to find, hire, train, and pay sales reps. These are people who are already in sales, many of them already calling on the medical field and healthcare providers. And we'll show you how to find those people and get them out there working for you, bringing you the signed contracts. So even if you don't have the time or the inclination to do any marketing whatsoever, there are people who will do that. We'll show you how to give them commission only, which means you don't pay anything up front. They're going to make a commission each month and build up a residual income just like you are as well. Okay, Eric. Hey, we're about halfway through. I've got a few more points here, but you want to see if there are, I don't see any questions coming in.
I was about to say, I know we're kind of past the bottom of the hour and we haven't really gotten any questions, so maybe we're covering what they have. So
well, I know we had about 40 people registering for this, so right. I guess it's Christmas, it's holidays. Why are we even on this today? Why are we even doing this webinar? We're answering all the questions, I guess, as we go. So, but folks, those of you who are on the webinar and want to ask a question, you just be sure and type it in there. We'll address them as they come up. All right, here's the next point.
You don't have to have all the answers.
You mean, Eric, that the people who go through our training, when they go out in the field and face the doctor or the office manager, they don't have to have all the answers?
That's correct.
Why is that?
Well, because you have ABS behind you. That's the biggest part. And really, because we answer those questions. I'll tell you real quickly. how we do that. And that's through these demos. We take folks like yourself who are in the medical billing business and their doctors who are interested in utilizing your services, and we step them through the demos, and we answer all the questions that the doctor has. You just basically turn the go-to meeting over to us, and we actually answer those questions for the doctor. So what your biggest job here is to do is simply just get the doctor to a demo. That's really what you want to show them, and we'll take it from there.
And the last question they ask usually is, how do I get started? That's where you want to have a proposal ready.
Sure, exactly. Now Wayne does ask a question here: is the billing to the doctors part of the software, or is that something that we do? Well, it is something we do, or something that you do as the licensee. So remember, anything that you're doing to help that doctor collect their income is what you're going to be invoicing them for.
Right. Wayne, we will specifically go over that in the training as to how you charge the doctor and how you bill the doctor. There is software available that will let you bill the doctor based on the revenue. It's very simple. If you bring in $100,000 this month for the doctor and you charge 6%, then you bill the doctor $6,000. That's how simple the billing is to the doctor. Or if you're smart, we'll teach you how to do that automatically. Now, maybe they won't do this the first month or two, but you build this into your contract that after the second month of billing, if everything's going smoothly, you're going to actually debit that right out of the doctor's checking account. In other words, he'll get an invoice from you showing how much money that you collected for him or her, and then the figure that you're going to actually deduct from their checking account. And that's the best way to do it, because that way you don't have to wait for them, to write a check. Why else do they not have to have all the answers? Well, it's because of all these people. It's our support team. And by the way, we have actually over 200 people involved with all of our technology partners that can answer those questions for you. So, Eric, if you were out in the field, for example, and let's say you get ask a question about, I don't know, about insurance, and you don't really know, not only do you not know the answer to the question, you don't even know what the question means. What would you say to that officer?
I'd say, you know what, that's a great question. I'm going to take that to our support team, and I'll get back with you with the proper answer.
Right. Let me get with my insurance specialist at the office. Well, folks, that's us. You turn to us. We know, or our technology partners know, the answers to every question that could possibly be asked. And so you can always get an answer to any question that you're asked out there that you don't know the answer to. We know the questions and the answers.
Right. Exactly.
All right, so Eric, this one has to do with the lower rejection rate from the payors. Define a payor. Who is a payor?
Okay, payors are going to be your Blue Cross Blue Shield, Aetna, United Healthcare, Medicare, and Medicaid. Those are what the payors are. When Patrick's talking about a lower rejection rate, we're talking about from the time that we process our first claim with the doctor. That means that we're going to have more claims go through than what doctors are normally getting. That's the best way to put it.
Right. Hey, I see a question here from Gangahar, I think well, he's asking about a particular state on the East Coast as to whether we have any licensees. Gangahar, that's probably one of those questions that you should ask your ABS rep. We don't have that database open right now while we're doing this live webinar, so I don't know that we don't have somebody in your state. But even if we do, there's probably lots of doctors out there to be able to market to, and you can find that out on our website. There's a little link up there under, I forget what it is, tools or something like that, isn't it, Eric, where they can actually go find the number of doctors in their area.
Sure.
And usually there are thousands of doctors within, say, 40, 50-mile radius of your city. And that means that there's plenty of business out there. We would not put a second licensee into an area where we had an active licensee marketing out there anyway. Okay, let's see. Lower rejection rate we were talking about. Okay, well, here's a quote from the American Academy of Professional Coders that tells you exactly what that rejection rate is. Industry experts have found that the average number of rejected claims for a medical practice averages around 34%. Eric, we've seen some up to 60 and 70% rejection. Now, why is that? How is it that claims, what causes them to actually get rejected?
Well, they could be rejected. Now, let's just take the simplest portion of it, and it could be rejected just simply because the name might be misspelled, or we've got an incorrect phone number, or an incorrect address, or you know, folks, every time we go to the doctor's office for the first time, we're asked to fill out a patient information form, and then somebody has to take that and then translate that into a system, and that's the first thing, starting with the medical billing and everything. So whenever you go to process that claim and it goes to the insurance and it doesn't match exactly how that insurance is, that's how that claim will get rejected. That's why those rejections can be so high.
Well, yeah, and like this article says here in the subheading, proper medical billing and coding is important for correct insurance payments. Folks, if the doctor has not updated their codes lately, they could be getting way underpaid and a lot of rejections by using the wrong codes. That's where you come in. With some of our services, remember, they're done by our certified medical coders for you. You can offer that doctor the ability to examine their codes and make sure the codes are what they need to be. And because they're all built into our system, uh, that means that the codes are always going to be accurate no matter what, because it's constantly updated with the most accurate, latest codes. So here, for example, is where on our system you're actually typing in some of the codes. You can search for those codes by the code itself, which it's just a 4 or 5 digit number, or the description. And by typing that in, the code will show up automatically. Then you just drop that in where it goes, and the claim is submitted. That way it is accurate. By the way, Eric, that's interesting. Codes are now what they call version 9, right? ICD
Correct.
9 codes, and what's coming up soon?
The ICD-10s, as you can see right there, it's already ready, and we already have those in our system. So we're actually helping doctors right now prepare for changing over to their new codes come October of 2014.
Yeah. Okay, and of course that makes everything else in the system and the claims that are being submitted more apt to be accepted by those payors because it is in the system accurately. You can also get complete reports directly from the system for your doctors to see exactly what the rejection claims are and why they're rejected and how to correct those. All right. Here's another too good to be true. Lifetime access, Eric. How in the world could a company provide lifetime access to support and resources?
Well, because folks, bottom line is that we want you to be successful. Because if you're not successful, we're not successful. And I'll let Patrick explain how and why that works that way, and why we're not a franchise where you're having to pay franchise fees.
Yeah, for example, here is one of the resources you'll have. This is our, it looks like kind of like our website, but if you'll notice up here in the corner, it is our licensee support site. So you'll have a private login and password to this site just for our licensees that has oodles and oodles of stuff in there, training, videos, documents that you can download. I mean, it's just full of marketing tools that will help you build your business. And all of that's accessible to you. And you also have access to our licensee forum, which is where we give you access to all the other licensees from coast to coast that are utilizing our system to be able to ask questions and interact with those licensees. So there's no situation that would come up that you wouldn't have an answer from, not just from us as a company, but from people who are also out there building their business as well. This is all available to you as long as you're an ABS licensee. So it is a lifetime support that you get. And one of the reasons for that, as Eric said, is because on all of the services that you'll be offering to doctors in your community, ABS has set up our model as a business to be able to make a few pennies on each of those transactions. So we are a transaction-based revenue model. That means, folks, that the more successful you are and the more transactions that you have go through our system, the more we make as a company, which means we're going to be around for a long, long time to come, no matter what. That's why we don't charge any ongoing support fees whatsoever, ever.
And that's what takes us into this too good to be true on non ongoing cost and royalties. That's exactly what we're talking about here, folks. there's no other business that I know like this that doesn't collect these type of fees and be able to stay in business as we are. And the model that we have here at American Business Systems is a win-win-win. Whenever we say that, it's a win for the doctors first, it's a win for you as a licensee, and then it's a win for us. We're all working, and when we're collecting money for the doctor, we're all collecting money for everybody.
Yeah, I mean, unlike most of the franchises that some of you may be looking at, they will take a 6 to 8 or 9% right off the top of every month's revenue, and that's gross income, not after all your expenses, but the gross, which is a huge chunk of money that they're taking each month. Now, with our situation as a licensing situation, we've set it up so that there is never any money that you ever pay to ABS directly after you've become a licensee. So no ongoing costs whatsoever. That's the reason we do that, is because we make money on all of those services that you're offering. Wayne is saying, Eric, let's see, he says, I'm interested in the lunch meetings. He's talking about those lunch and learns that I mentioned earlier. But he says, I'm
Right.
not a speaker. How do you offer someone that can come in and speak on our behalf? Well, we've got even something better than that. We have recorded webinars and presentations that you can use, Wayne, in the office to make the presentation for you. We don't have to be there. It's not going to cost you anything. Those are provided to you as a licensee. As long as you have a laptop or an iPad or a tablet device, you can actually make that presentation there live in the doctor's office without having to worry about you saying anything. So it's a great way to do those lunch and learns without having to be live there in the office. Uh, I threw this picture in because it reminded me, Eric, that one of the advantages that people get into our business for is because they are truly in business for themselves, but not by themselves. And
Right.
I think that's part of why our licensees are so successful, don't you? They have the support that they need, but they don't have the control that a franchise would give them.
Right, exactly. Yeah, you're able to do and operate as independently as you want to, or even as closely as you want to work with us. I mean, that's why when Patrick put up those pictures earlier of Dr. Combest and Terrence Patterson, those licensees are working very closely with us, and we're helping them build their business, and then likely they're helping us build our business. So we will work as closely with you, or if you want to work as independent as you want to, you can do that as well.
That's right. They are on our advisory board because we've asked them to be on that. We compensate them for their time in spending time with you as another licensee, helping you to build your business. So whatever need you help you need, that we're there to provide that for you. Eric, somebody's asking here about the next training workshop in January. Do you know the one that's coming up after that? Is there one in February?
There is not one in February because we do this every 6 weeks. The next one will be the first full week of March.
Okay, so the first week of March. All right.
Yep.
Okay, well, let's look at one other too good to be true item. That is increased revenue for medical practices. Yes, not only can you save them money by outsourcing the billing to you, but you can actually bring in more money. Now, we've hinted at this, but folks, we actually have a spreadsheet that looks like this with all the formulas already plugged in. All you do is plug in some of the numbers that you're going to be getting from the office manager, like the number of claims filed monthly, the average amount billed per claim, the approximate rejection rate that they currently have, and so forth. We'll go through this in detail in our live training workshop and show you what all the numbers mean and what's behind each one of them and what to expect. But look, bottom line is you're going to be able to print out a report that looks like this, showing this particular practice increasing their revenue by 40%. That's $11,500 a month in
Right.
additional revenue, or 138,000, almost $139,000 a year. So
And then you put your numbers to that. If you just take that 138 and increase revenue and times that by 6%, that's a good amount of money. And you just couple that out with, I think you see here the monthly practice revenue underneath this projected. That's about $40,000 a month. Again, you could times that by 6%. That's going to give you basically what kind of money you would be making.
Yeah, I forget what we used in this particular example, but as you can see, the outsourced billing cost for this doctor with your service would be about $3,500. So you're charging the doctor $3,500. Folks, that comes out to almost $40,000 a year, doesn't it, Eric? Yeah, for this
Exactly.
one practice.
For that one practice. That's
Mhm.
right.
Okay, here's a real life example of this, by the way, that one of our licensees sent to us. This is a doctor that was using their current system, doing about 7,200 claims per month, and the average claim was about $125. That's about $900,000 a year in billing that this one doctor's office is doing. Well, look, their rejection rate, as I mentioned earlier, Eric, we have them up to 50, 60, 70% sometimes. This one was at 60%. We got
Yeah.
it down to 2%. That increased their revenue by 41%, or about a $500,000 a year.
Yeah.
So they
Unbelievable.
were pretty thrilled about that.
And this was, I believe, if I can remember correctly, this was actually done on a surgeon. So this is a
Yes.
lot of money being left on the table.
Yeah. We find a lot of that Porsche money out there.
Yeah.
All right, the last item I wanted to cover today, Eric, was this one. There is a 2014 window of opportunity. Let's open the windows.
Exactly. Folks, what we're talking about here is it has everything to do with electronic medical records. And this is really a key year because by the end of, or really by the beginning of 2015, the doctors are supposed to be on an EMR system. And so, folks, this is a great year because there's a lot of doctors that are leaving their current electronic medical record systems right now, left and right. They're too cumbersome to work through. And again, when we show the doctors our EMRX system, they find it to be very user friendly and complying with everything that the Medicare is requiring and the government is requiring.
Yeah, Eric does some of the demos for the doctors from time to time. And Eric,
Exactly.
you hear those doctors throughout the demo just kind of awed by what you're
Yeah,
showing.
absolutely, all the time.
And one of the reasons why they're excited about that is because part of the stimulus money that was set aside for doctors uh, in this new Patient Protection and Accountable Affordable Care Act is money that the doctor can get. For example, they can get $12,000 just next year for utilizing meaningful use of an electronic health record system. Ours happens to be one of the few that are out there that are qualified for that money. And not just next year, but the year 2015, they can get another $8,000 for using an EHR that qualifies, and another $4,000 in 2016. So a total of $24,000. Folks, this is like giving away candy. It's like giving away money to doctors. Water.
Exactly.
And so we'll teach you how to do that as well and tap into that. What a wonderful window of opportunity. Eric, I think if there was ever a good time to get into this business, it has to be right now,
Right now.
2014.
Yeah, because there's so
So
many things that are happening here in 2014.
there are lots of different things. The new ICD-10 codes are coming in and so forth. So it's just perfect timing. So, folks, I hope I've helped you to realize that there still may be things that you think about our opportunity that are too good to be true. And in fact, I see a couple of questions here, Eric, that I'm going to address
Yeah.
before I move on to that.
Yeah,
One
let's
of
talk
them,
about Grace. Grace she has a great question there.
oh yeah, is the cost for using iClaim passed to the doctor, or is this included to the doc as part of the percentage billed to the doctor? Exactly, you got it right, Grace. There are no ongoing costs to you as an ABS licensee. You're going to pass all of those costs on to the doctor. So the doctor covers all of the costs of using the iClaim system and sending the claims to the clearinghouse. There is no cost to the ABS licensee at all. Good question.
Yep. And then let's see, Nishad asked, how much time does it take on average to complete one claim?
And that is a great question. Eric, on average, what does our research and development show?
It shows that to really process one claim, it takes about a minute at the most. to actually process a claim. And it can even be quicker than that if the doctors are actually on our EMRX system, because we get those claims directly from the doctor as soon as they see the patient. And when they're through seeing the patient, that ends up on our side to literally do the processing of those claims. So it's very, very fast. So, Nishad, to kind of help you understand what we're talking about here, we're talking about one doctor should take you on average about an hour to, at the max, 90 minutes a day to do the work for one doctor.
Right. That means at some point, of course, as your day grows and your clients grow, that you may want to hire some independent contractors to help you with that data entry, or maybe even get to the point where you're actually hiring employees, like some of our licensees are. We've got a licensee out in California that I interviewed last week, that Tierney Martins. She has over 40 doctors now, 44, I think she said, and she has like 8 or 9 employees that work for her.
Right. Right.
So back to the too good to be true. If you still think it's too good to be true, let me encourage you to talk to some of those people like Tyranny and some of the others that you see pictured here on the screen. These are some of the slides that I've used in previous webinars where I've talked to those people and interviewed them. We have recordings of all those interviews, and just ask your ABS rep to see some of those, or go to our blog out there on our website. You'll see our blog, absystems.com/blog. And you'll see some recorded interviews with some of these people. Ask these people. These are the folks who've been through our training. They did their due diligence. They researched us as a company. They made the investment. They came down here for the week training. Some of them were back so far that they didn't even have 5 days. We were doing 3-day training at one time, Eric. So,
Right.
but they'll answer all your questions. And we don't tell them what to say, do we, Eric? I mean, they're
No.
independent business owners that can say anything they want to you. But they've
Exactly.
agreed.
Absolutely.
Some of them have agreed graciously to take those calls from prospective licensees and ask them. In fact, some of them have commercial office space, and we'll let you come visit them there in their office space. Well, Eric, one last quote from Medical Economics. This came out in April of this year. I think this is great because I couldn't say this any better. If you're still wondering if medical billing is a good industry to get into, look, it says right here, at no time in medical history has there been a greater need for expertise, technology, compliance assistance, etc. There's simply no entity in existence positioned to meet these needs better than the third-party medical billing companies. That's what you will be as you go out in your community to help those doctors. So, there's the rest of that quote. It just basically says that it also lets the doctor focus on concentrating on their priority, which is providing health care to people.
That's correct. Yeah. And we do have a very big aging popularity, so we're things are moving very fast.
Yes, the baby boomers have hit, haven't they?
Exactly.
One reason I think, Eric, that our opportunity seems so too good to be true is because we do have the complete solution that nobody else has come up with. We're the only company in America, folks, that has the cloud-based billing system that is on the leading edge of technology for medical billers. We have the electronic medical record system that is ideal for doctors using the iPad specifically in seeing the patients. We actually have our clearinghouse built into our system. There is no third-party clearinghouse that those claims are sent to. So you can't blame anybody else if it gets stuck and it doesn't get accepted. It's all our fault, right?
Exactly.
And then there's one last piece of the puzzle that most people forget about, and that is, in any company, it has to do with the people. Without the right people behind all of this, helping you, supporting you, guiding you, taking your hand, and leading you to success, it really would be too good to be true. But we have it all, and we've put all that together just for you folks. All right.
Patrick, we've got about 2 more minutes here, and let's kind of talk about the January training. It is just a few weeks away, January the 20th through the 24th. Now remember, those that will be attending the January training will be receiving a mini iPad as part of our thank you for helping us celebrate 20 years here at American Business Systems. And Patrick, as we close here, I know one other thing that seems too good to be true, and that is about the training and your money-back guarantee. You want to talk about that as we close out here?
Yes, I just want to remind everybody also that there is that mini iPad that everybody coming to the January training is going to receive. Now, that's just something we've never done before, but we're going to do that for January to kind of celebrate our 20 years of business. Here's the guarantee Eric was mentioning, folks. It says, just like it does right in your agreement with us, that if at the end of the training workshop, for any reason, you don't think this business is right for you, just tell any of my staff and they'll arrange for you to receive a full refund of your license fee. Every penny that you've paid to us will be returned to you if you don't think this is right for you. That's your definition of what's right, not ours. So, folks, there's no weasel words in this guarantee. This is a straightforward guarantee, and we have given three people, I think, in the 20 years we've been in business. At the end of that class, three people have asked for their money back, and that was because they had some real specific things happen in their lives that had nothing to do with really our opportunity at all. But anyway, I'm just being honest with you that has been paid out, and it would be paid if for some reason you decide that it's not right for you. Well, meanwhile, Eric, it seems like a while off, but folks, if you don't have your due diligence done to get to this class, Eric, this class is almost, I was just told by Rhodey this morning, it's almost half full. That means there's only a handful of seats left. So if you want to be in the January training and get the mini iPad absolutely free during that class, then be sure and get your paperwork done, get in to us. And Eric, if we didn't answer all the questions, let's tell them to just send those into their rep, and we'll be glad to answer those, right?
Absolutely. Matter of fact, all questions that didn't get answered today will be forwarded